All right. Hello, everybody. Thank you for joining us today. I'm seeing some good people come on in, so thank you for being with us. We really appreciate your time and your effort. We're here with Tiffany Cloudman today. She's going to give you some great information about elder care. I am not the expert, Tiffany. You're the expert, and people are here to hear from you. So the floor is all
Thank you.
yours.
Awesome. Thank you, Jack. Good morning, and thank you for joining today's webinar on Elder Care is Everywhere, what caregiving employees need from their employers and how to help. I am Tiffany Mann, and I'm the Elder Care Coach and Community Partnerships Manager with AgeWell Middle Tennessee. AgeWell is celebrating 40 years of serving as a trusted resource, advancing solutions to meet the critical needs of older adults and caregivers. Just a little bit about me before we get started. I have 15 years experience in the caregiver support field, as well as supporting those affected by Alzheimer's and dementia. I'm excited to share with you today information, resources, and helpful tips on how you can help support those who are working and juggling caregiving in your workplace. This is a favorite quote by many in the caregiving field. It is by former First Lady Rosalind Carter, and she says, "There are only four kinds of people in this world: those who have been caregivers, those who currently are caregivers, those who will be caregivers, and those who will need caregivers." As we can see, we will all be touched in some way by caregiving, and it's all of our jobs to fill the gaps where we can in supporting caregivers. There's been a significant increase in the number of families caring for aging loved ones. This has become a priority issue for AgeWell, especially given that Tennessee ranks 47th among states for long-term services and support, according to AARP's 2023 Long-Term Services and Support Scorecard. And 51st, Tennessee ranks 51st for support for family caregivers. So, before we go much further, I would like you to take a look at our first poll. How have you been affected by caregiving? Please pick the answer that most represents you today. You can see there are several choices on the screen. I've been a caregiver for an older adult. I'm currently a caregiver for an older adult. I anticipate being a caregiver for an older adult, or will probably need a caregiver at some point as I grow older. We'll just give everybody a few more seconds to answer this question. All right, it looks like our answers are still a few more coming in. It looks like the strongest answer was I anticipate being a caregiver of an older adult, followed by I'm currently a caregiver for an older adult. Thank you so much for answering that poll. We're going to go on to our next slide. There we go. Thank you for your patience. All right, so what are we going to discuss today? Our topics. So after today's presentation, I'm hopeful that you will be able to recognize who are today's working caregivers. What are they juggling and what do they need? That you'll understand more about the challenges caregivers face caring for someone with Alzheimer's or a type of dementia. That you will learn best practices and benefits needed for a caregiver-friendly workplace, and that you will be able to identify by the end of today's presentation supportive resources in the community for older adults and their families, and how AgeWell's program Elder Care Coach could be one option for you in helping your caregiving employees. My goal is to help you care for your caregiving employees, and in doing so, see how it can also help your bottom line. As we get into the topic, I want you to keep phrases like whole person health and a culture of care in mind. I'm sure you've heard these phrases in the benefits and HR workspace, and both apply deeply to our topic today. Just to share a little bit about AgeWell, our former name is the Council on Aging, and we started in 1985. We actually came out of an identified need out of the mayor's office, and we cover 13 counties in Middle Tennessee. So that's Davidson and contiguous counties. You can see on your screen, we have three key roles. The first is to be a trusted and impartial community resource. We also get the honor of being a catalyst for solutions to unmet needs. That just means that we are listening and looking for the unmet needs of older adults and caregivers in our community and coming up with solutions. And we also get to champion and advocate for older adults and caregivers both at the state and local level. A little bit about our resources at AgeWell, and I'm going to share more about these as we go on throughout our presentation, but we do have a directory of services, which is a resource guide for older adults and caregivers, as well as those professionals working in the field with those two populations. We have that available both in print and online. Again, I will share more about that with you towards the end of our presentation. We have our helpline, which is available Monday through Friday, where an older adult or caregiver can call if they are looking for a resource or help. We have our three guidebooks that were designed by subject matter experts and caregivers in the field. You see those three titles on your screen: Aging and Caring, Empowering Grandparents, and Preparing and Planning for End of Life. Each month, we put out education on scam prevention. We know this is a big topic where we're trying to help older adults and caregivers prevent any scams that could come their way. I will share more with you as we go about Rubric and Eldercare Coach, which are caregiver support resources. And lastly, our last resource on that screen that I'll briefly mention is Reset. This is a new collaborative effort with other nonprofits in the community where we are actually trying to help older adults 50 and older connect with financial benefits that can help them in older life to thrive financially. So, getting on to our topic, why care about elder care? Well, in the 2020 census, it reports that 10,000 baby boomers are turning 65 every day through the end of this decade. So by 2030, all baby boomers will have turned 65. The US baby boom describes the dramatic increase in births following World War II. That was between the years of 1946 and 1964, when 76 million baby boomers were born. The US Census Bureau reports that in 2034, older adults are expected to outnumber children under 18 for the first time in the history of the United States. And just to share with you about Tennessee, currently there are 1.6 million Tennesseans 60 and older. We know that with age comes more chronic disease and health needs that we may need help managing. So, elder care is everywhere, and will continue to increase in need. So, baby boomers may need that care, but who are caregivers today? So, caregiving basically means that you are giving of yourself physically, emotionally, or financially. And you can see the brief definition on your screen. A caregiver is a family member or friend caring for an older adult or a loved one with a disability. And that's kind of the caregiver definition in context of what we're talking about today. There are primary caregivers, secondary caregivers, and long distance caregivers. And I want to give you an example of all of these. So, a primary caregiver, and again, we're talking about who are caregivers today. Why do we need to know about who they are? Well, if caregivers don't recognize that they are actually caregivers, they may not reach out for the resources, support, and education that they are going to need along that journey. So, a primary caregiver might be someone whose loved one lives with them, or they are providing care day in and day out. A secondary caregiver might be someone whose loved one lives in a facility like an assisted living or memory care, and they're still still there to provide emotional support for that person. They're still there to advocate for that person. Most likely, if they're in a community like that, they are also still taking them to doctor's appointments and errands. So, secondary caregivers are still caregivers. And then we have long distance caregivers. These are people, including myself, that may live several hours from their parents or the loved one that they're caring for, but they are still that advocate for them. They're still providing emotional support. And long distance, they may be helping with that loved one's budget, paying bills. They may be scheduling doctor's appointments. Some of them may just be sending money home to help supplement their loved one's care, but all of these people are caregivers. Some caregivers don't identify as caregivers until it's too late. And so we want to really help people, both in our personal and professional life, recognize if they're caregiving. And this is where you, as HR professionals and employers, can help your employees recognize if that is the role that they have taken on. So, again, taking a loved one to a doctor's appointment, running errands, preparing meals for them, all of these things make someone a caregiver, as does managing their finances and providing emotional support. And I'll throw a couple other things in there. This could also look like helping a loved one hire help in the home to care for them, or maybe moving a loved one to an assisted living or a higher level of care. So, caregivers have lots of tasks. All of those things make someone a caregiver. And I would also encourage you as an employer to assume your numbers are higher. So, you may have heard from employees before today's presentation who are already in this role as a caregiver. But we know, as we'll talk about later in this presentation, that many employees don't always identify to their managers or to their bosses as caregivers. And so just assume that your numbers are higher. So, that last bullet point, I want you to think about who is the average caregiver today? So, we're thinking about gender and age, and how many hours do you think they provide in care each week? So, again, who's the average caregiver today? How many hours of care are they providing each week? So when we're gonna talk about what's on the screen. So you can see the typical caregiver today is 49 years old and female, sandwiched between children and aging parents. So when we take a look deeper, we see why caregiving employees might struggle with work-life balance. The typical age and gender of a caregiver is 49 years old and female, working a paid job and helping with a parent or an in-law. They're sandwiched between dependent children and aging parents or in-laws. And you can see those bubbles across the bottom of the screen. They spend on average 24 hours a week helping with tasks like bathing, dressing, and shopping. And then you can see some caregivers, nearly a quarter, are providing 40 hours a week of support to their loved one, which of course is going to lead to higher stress and burnout. 6 in 10 caregivers are helping with tasks they most likely weren't prepared to help with, things like giving injections, giving medications, possibly incontinence needs. So caregivers are doing a lot that they weren't prepared for. The last caregiving in the US report back in 2020 said that there were 53 million caregivers in the US today. That's 50. And so when you think about it, it's 53 million stories of individuals providing care. This number is expected to rise to 62.5 million in 2025. And just to give you a little perspective on that number, the federal government is the largest employer in the United States with a workforce of approximately 2.95 million people. So when you think about 53 million, caregivers do essentially make up our largest workforce in the US. And just to look a little bit closer about who is caregiving, this is from the RRF Foundation for Aging in Chicago, and it gives us a breakdown on who today's family caregivers are. And you can see on the right of your screen who they are by age cohort. One thing to note is that we talked about who might need care, those baby boomers, and they are actually the largest age cohort offering care, providing care to loved ones at 34%. You can see the gender breakdown in the top two squares, and then I want to mention the bottom two squares. So Today, I've heard everywhere from 61% to about 73% of caregivers are working and juggling care, and 45% have had at least one financial impact. And you might ask yourself, what could that be? Well, it could be that they are long distance caregivers and they're spending money on flights home, hotel stays. Possibly they are sending money to their loved one or giving money to their loved one who needs care to supplement their own financial resources. They may have had to take a job cut. They may work part time or hourly and not get paid for the time missed at work. So we know that caregiving not only impacts someone emotionally and physically, but also financially. So, the juggling act of caregiving, I wanted to read to you a little vignette from Family Caregiver Alliance. It's at caregiver.org. This vignette really describes what we see on our screen, and it's all the things that caregivers are juggling. So, some of these things are things that we have to juggle. Some of these things are things we want to juggle because they make us, they take care of our own health, whether it's social connection or spiritual care, but they're all things that caregivers are trying to keep up in the air. And the vignette is: last week, Arlene missed 2 days of work when she felt uncomfortable leaving her elderly mother home alone. Recently diagnosed with dementia, her condition makes Arlene fear that she will wander off or accidentally hurt herself or damage her home while trying to complete a task as seemingly simple as making lunch. This week, Arlene's desk is overflowing with paperwork and deadlines. Her mother has a midweek appointment with her doctor, and Arlene's children are expecting her on the sidelines at two soccer games. The tasks related to work, family, and caregiving are piling up. Arlene is beginning to feel like she has one too many balls in the air. So, again, an example of all that caregivers are dealing with, which leads to caregiver stress and a negative impact on the caregiver, both emotionally and physically. So, on your screen, these are 10 ways to identify caregiver stress from the Alzheimer's Association. And this can really help you as an employer to recognize maybe any of these symptoms in employees that could be also juggling caregiving. So, denial kind of looks like, I'm in denial about what's happening. Maybe I'm feeling anxious and making up kind of all of those what ifs that could happen. I might be socially withdrawing. Maybe I'm not enjoying time with friends any longer. I could be angry about the situation or possibly angry at the person who needs care, which all of these things are normal. I might be feeling depressed. This is more than just a blue day. I could be having fatigue, which, doesn't mean that I'm sleepy, but just really worn out by the situation. I could be more irritable and sensitive to stress. I might be having trouble concentrating on tasks. I possibly have more health issues that have come up. I'm more sick. Or possibly I'm just experiencing sleeplessness, which could mean I have trouble going to sleep or staying asleep. And all of these things are normal for caregivers. We're all going to experience these things wherever, really any type of caregiver across the lifespan, whether it's children or caring for an older adult. They're all normal, but when they start to affect our own quality of life, that's really when we need to start seeking some help. We know that caregivers, then because of that emotional stress, there's a negative impact on their health. And I'm going to go down the bullet points, but caregivers suffer from increased rates of physical ailments. And this is from the Family Caregiver Alliance website as well. So caregivers are in worse health. They also have increased risk of heart disease, so higher blood pressure, diabetes, higher levels of cholesterol. Caregivers have lower levels of self care. We know that caregivers are less likely to do things like fill a prescription because of the cost, or maybe they haven't gone to the doctor as often as they should. They may lack the time and energy to prepare proper meals and to exercise. And lastly, we know that caregivers pay the ultimate price by increased mortality. One study I just want to read briefly to you comes from MetLife's Mature Market Institute study back in 2010, and it said caregivers typically experience 8% higher costs compared to non-caregivers, and this is in health related costs, potentially costing employers an estimated 13.4 billion annually in the US. So this is again due to the stress of caregiving, which can lead to health issues like depression, diabetes, and hypertension. So we have talked about who might need care, our older aging population. We have talked about who our caregivers are and all that they are juggling. And I wanted to put this slide in there because many caregivers are most likely going to be caring for someone with a type of dementia. We know that age is the largest risk factor for dementia. So again, with more baby boomers aging, we more than likely are going to see more people affected by dementia. You can see in 2024, the Alzheimer's Association in their facts and figures report reported that 6.9 million Americans aged 65 and older are living with a type of dementia, including Alzheimer's. 1 in 9 people 65 and older has Alzheimer's, and 2/3 of those people affected with Alzheimer's or another type of dementia are women. Again, women, why are women at higher risk? Well, women tend to live longer. And so again, age is that larger risk factor. We also know that women tend to be caregivers more often. So again, women affected at a higher rate. And then older Black Americans and older Hispanic adults are also affected at a higher rate with Alzheimer's or other dementias because of the cardiovascular factors that can make someone more susceptible to developing dementia. I wanted to share a little bit with you on the challenges for caregivers and caring for someone with dementia, because this could affect those caregiving employees. So, those employees who are also caregivers, it could affect them even more on the job. So, we know that safety is something we continually have to monitor for those with a dementia diagnosis. It can affect their safety at home, when they're alone with driving. They could also wander off. And so for working caregivers, this could mean that they're concerned, is their loved one safe while they're at work? Are they thinking about their loved one more often because they're concerned about their safety needs? Alzheimer's also affects communication for the person with dementia. That person with dementia may start to have trouble as they progress in their disease, understanding what their caregiver is saying and then having trouble expressing themselves to their caregiver for what they need and want. So you can imagine caregivers at work, it could make it harder to communicate with their loved one, especially, over the phone and things like that. And then also, those with dementia may need someone at every doctor's appointment because they're having trouble, again, with communication. Dementia and Alzheimer's also can affect that person's behavior. We think a lot of that is related to the breakdown in communication. We know that every behavior has a purpose, and sometimes it is to communicate something. And so, for that person with dementia, it can make it harder at times to provide care to someone if they're having lots of behaviors related to the disease, which then can make it difficult for that caregiver to find care. And then lastly, we know then that all of these things can make it more stressful for the caregiver. And we know that the caregiver is the most important person in this relationship. If the caregiver isn't well, they can't provide the care that they want to their loved one. So caregivers may find it very difficult to take care of themselves while also working and caregiving. All of these things make caregiving harder and even more stressful if you are also managing a job. So, to kind of sum up what we've talked about so far, caregivers have lots of challenges and concerns that come with not only caregiving, but also juggling caregiving and work. The healthcare system can be very stressful to navigate. Care can be very expensive. To pay for someone to come in the home or to possibly move your loved one to, let's say, an assisted living or memory care can be really expensive. Caring for someone, as I mentioned, with dementia or Alzheimer's can be challenging, but work is necessary. Caregiving employees, They need a salary to pay for care for their loved one. They may need health insurance for themselves or their loved one. And they may feel uncomfortable telling their manager about their elder care concerns and needs. So it's no wonder that employees may feel overburdened and overwhelmed. And next, we're going to look at how caregiving affects the employee and the employer and who your caregiving employees might be. So, how are employers affected by these items on the screen? Attracting talent, retaining talent, and productivity if the employee is a caregiver. So, I'm going to give you kind of some food for thought. So, with attracting talent, the caregiver might be thinking, the caregiving employee might be thinking, does this job have benefits that will help a working caregiver? Does the company have a culture of care? And you may already know what a culture of care is, but as a reminder, a culture of care in the workplace means fostering an environment where employees feel valued, supported, and respected, which leads to increased engagement, retention, and overall well being. It goes beyond basic policies and emphasizes genuine concern for employees' physical and emotional well being. So, again, work life balance and that whole person care. In terms of retaining talent, the employee might be thinking, does my job value me as an employee? Can I talk to my manager if I need to explore flexibility, job sharing, etc.? I want to work, but I'm not sure how I can juggle all of this. Who can I talk to? And then in terms of productivity, we're really thinking about presenteeism, so being focused on the job, and absenteeism. So the caregiver might be thinking, can I focus at work? I need to find resources to help my situation and make calls, but I'm not sure when to do that. It's very overwhelming to navigate. For example, my mom has another doctor's appointment this week. I'm not sure I can miss work again. What resources can help me? And to sum all of that up, caregivers really need a navigator. So who is caregiving? How do you know which employees are also caregiving for an aging loved one? Well, the picture on the screen, we know that caregivers do not wear capes to work, and they aren't going to typically raise their hands for help. It is common for employees to care for others in their family without mentioning to their managers as well. They may rarely reach out for help. And as I mentioned, sometimes they don't even consider themselves in the caregiver category. They don't want to be seen as unreliable or unavailable if a career opportunity presents itself, but they worry constantly about losing their job due to caregiving responsibilities interfering with workplace responsibilities, which causes undue stress. So what happens from here if it ends up taking a toll on them? Well, it's their job, costing the company an absenteeism, lack of presenteeism, perhaps losing a great employee, and then the attract, retain cycle begins again. As we move on, I'm going to share with you what caregiver employees say they need and want from their employers. But again, before you can address the needs of your employee population that are family caregivers, first you want to identify who they are and, probably most importantly, create a culture where they feel safe to talk about their family caregiving. Okay, so this slide was a 2021 study from the by the Rosalind Carter Institute for Caregiving. And they found that and so on this slide, we're really honing in on employee productivity and retention. So keep that in mind. So in this study, they found that among employees with caregiving responsibilities, 73% had to leave work early or unexpectedly. So this could be an emergency, their loved one, maybe they're not safe at home, they've had a fall. 70%, and this one's not on your screen, but 70% had to call out from work one day. Again, maybe an emergency, maybe they're recognizing their loved one is needing more help. 68% did not take on additional responsibilities or projects at work. Again, they're probably feeling overwhelmed. 60% felt the quality or timeliness of their work suffered. 59% had to take 2 or more days off in a row from work. And if you are a caregiver, you know that making some of these decisions, like moving a loved one to a higher level of care or finding help in the home, that isn't something that happens quickly. It takes multiple hours and days often to accomplish that. And then lastly, 52% lost income because they had to miss work. One statistic not shown but highly relevant, research from the Rosalind Carter Institute has shown that close to one third of caregiving employees have chosen to leave a job at some point because of their caregiving responsibilities. So I'm curious, how have you seen caregiving impact your employees? I'd love, as you get a chance, for you to add comments to the chat about how you've seen caregiving impact employee attraction, retention, and productivity. So we're going to stay focused a little bit further on what caregivers are saying, but also thinking about employer attraction and retention. The Working Daughters in the Workplace 2023 research revealed that most family caregivers caring for adults feel invisible and unsupported at work. You can read the survey respondent quotes there on the screen. And when employers do acknowledge working caregivers, it can make a big difference at home and at work. By engaging with and supporting caregiving employees, companies can avoid a costly and unnecessary brain drain in the coming years. The next line item on there, caregivers also need flexibility. We know this, right? We know that flexibility increased with COVID and is highly important, influencing employee well-being, productivity, and overall job satisfaction. Flexibility enables employees to better balance work and personal life, leading to reduced stress and improved work-life integration. Additionally, flexibility can attract and retain top talent, as many job seekers today prioritize flexible work arrangements. And lastly, caregiving employees need emotional support. This is a need that can easily be overlooked in caregiving situations where the focus is typically on the person needing care rather than the person providing it. This level of support can meaningfully improve presenteeism and increase productivity by reducing the time it takes employees to get caregiving guidance and support they need. So again, if they feel supported, they're not spending the time at work trying to find the help they need for their loved one. It also reduces anxiety that comes from feeling overwhelmed as a caregiver. A MetLife 2023 reported the reasons employees want flexibility is as varied as ever, including, though, caring for a loved one. So estimates suggest that the care caregivers provide is worth nearly $500 billion. That's 4 times what Medicaid spends on long-term services and supports. So remember, I told you about 53 million caregivers, that large unpaid profession out there that is invisible a lot of times. This makes caregivers the nation's largest healthcare workforce, an indispensable part of the health and social service delivery system for older adults, and a vital resource for our nation. But this does come at a cost to the employers. Companies lose, as you can see on your screen, about 17.1 billion annually in lost productivity due to caregiving. This is from the Family Caregiver Alliance. And not only lost productivity, but employees are having to exit the workplace, as I mentioned, or resign in hope of finding a more flexible environment. The Society for Human Resource Management reported that on average, it costs the company 6 to 9 months of an employee's salary to replace him or her. So for example, an employee making $60,000 per year, that could come to $30,000 to $45,000 in recruiting and training costs, which all comes again as at a cost to the employer. So, as you can see on the screen, caring for caregiving employees is it's not optional, it's essential. Eldercare is costing employers, and finding a solution to these needs is both good for the employer and the caregiving employee. So, next, we're going to explore further how you can better support these employees and make your workplace more productive. So I know everyone wants to be the best, right? So on the screen, you're going to see just some of the best practices for a caregiver friendly work environment. So that first one, reduce the stigma. So that means making an environment comfortable so that caregiving employees feel like they can talk about their role as a caregiver. And you do this essentially by leading with empathy. This could look like a manager or a higher level supervisor, a boss, someone sharing with your employees that they also have been affected as a caregiver. That can really open the door to not only lead with empathy, but create a culture of trust. The next one on the screen is to assess if your current benefits are meeting the needs. Are they being utilized? Do you offer flexibility, remote work, paid leave? Is there parity in your leave? So, not just parental leave, but family leave. We also see that um, benefits like caregiver support benefits can also cross reference to other benefits like EAPs, employee assistance programs. And oftentimes, this can strengthen the entire ecosystem of benefits. So, with number two, we're thinking about, are there blind spots in your benefits package? The third best practice is to learn about local solutions like Eldercare Coach, which I'm going to tell you more about here in a few minutes. But also, I want you to know there are also other tech enabled solutions out there to support caregiving employees, and you see some of those names on your screen. One thing I want to mention about funding services like that, like this, typically or sometimes they're not funded as a traditional benefit. They could be funded as a perk benefit. I've talked to employers that may fund them through an employee culture fund, something that just improves the culture of the workspace. I've also talked to an employer that was going to fund a benefit like this through a health and wellness fund. It was a kickback that they got from their health insurance provider. So funds that they could use to improve health and wellness benefits or health and wellness in the workspace. The fourth best practice on your screen is to survey your employees. If you feel like you aren't sure if many employees would find this benefit helpful, survey them, ask them what they need and want. And then lastly, as you all I'm sure know, with any benefit, it's so important to communicate your benefits to employees. If you already have benefits like an EAP or some type of caregiving employee benefit, communicate more and often to your employees to let them know what's available to them. One other thing, I'm going to go right back real quick. I noticed in my notes that I wanted to mention to you. A couple other things that you'll see in some literature that I'm going to share with you at the end of our presentation, but there are other creative ways that you can support caregiving employees. You can create a support group on your campus. You could have a backup emergency service that helps caregivers find help caring for their loved ones so that they can come to work. You can train your managers to know more about caregiving employees and what they're juggling with. So this brings us to our poll number two. To what degree is your organization caregiver friendly? So you can see the three options. We're already caregiver friendly with many of these best practices. We're somewhat care friendly, but could do more. We need to do more to be caregiver friendly and understand our employees' caregiving needs. Thank you for answering that poll. It looks like an overwhelming answer. 57% said we need to do more to be caregiver friendly and understand our employees' caregiving needs. And I'm sure that speaks to a lot of why you're here on the webinar today. And I'm so excited to share with you more resources to support your caregiving employees. Okay, so a couple other additional ways on your screen. These are creative Creative ways to support caregiving employees. The first one I want to mention is if you don't have an employee resource group, this is a great way, even if you had a specific caregiving employee resource group, it's a great place for those caregivers to share and get advice from others who are also in their same position. Recently, I heard about an employer creating a Slack channel, so a communication channel just for caregiving employees. So it's a great place that they can share with each other. If you have an employee resource group, bring up the topic of caregiving. And if you can, attend that meeting so that you can learn about the needs. Recently, I found a podcast, if you like podcasts, called Working Caregivers, The Invisible Employees. This is a great podcast to learn more about what caregiving employees need in the workspace. And they also have a book. I believe it's the same title. Consider adding a perk benefit for caregiving employees that will last. So this isn't just maybe like a ping pong table in the break room, but really thinking about how can we improve the health and wellness of our employees and give them a benefit that will last, that will continue giving to our employees, because we know, again, that very first quote that I read, if someone isn't a caregiver today, more than likely they are going to be put in that position later in life. So giving them a perk benefit that will last, and then keeping, again, flexibility top of mind. Just a few articles to share with you that I have read recently that you can find at Forbes.com and at the Employee Benefits News website. You can see those titles: Employee Caregivers, a Silent Pandemic CEOs Must Pay Attention to. The caregiving crisis is upon us. And then that last one was 14 easy last minute ways employers can show up for caregivers today. I also recently watched a webinar through Employee Benefits News, and the title was Whole Person Health: How Caregiving Support Complements Your EAP and Healthcare Benefits to Drive ROI. So there's definitely lots to listen to and read about on this topic in the community. So, as I mentioned, one of AgeWell's key roles is observing unmet needs of caregivers and older adults in our community. And several years ago, we recognized there was a lack of support for family caregivers in our community. So, AgeWell did some research. Several years ago, we had focus groups with caregiving employees, and we surveyed employers through MT, EBC, and MT SHRM. And here's what we learned that caregiving employees need and want. These caregiving employees said they need trusted information. They need expert guidance to navigate options, understand medical and legal issues, and make decisions. They need emotional support to help with stress and reduce feelings of isolation. And they need a caregiver-friendly workplace. The HR professionals in this focus group and through the surveys said that these things on the screen would be most helpful. So they need guidance on being a caregiver-friendly workplace. They need access for their employees to get information and resources, as well as navigation support. They need online tools, training, and links to resources, and printed materials and on-site education. And these surveys helped us shape and design our program, Eldercare Coach. So I'd like to tell you about Eldercare Coach, a low-cost turnkey solution perk benefit that AgeWell has created. As a nonprofit that supports older adults and their families and has a mission to address unmet needs, we saw a need, again, to improve support for family caregivers. The three components provided, the three components provide trusted information, expert guidance, and emotional support, things caregivers said they need. Elder Care Coach phone consultations are with a geriatric care professional, a licensed master's level social worker, who provides trusted, personalized information and care navigation assistance. Our online portal, eldercarecoach.org, includes easy to navigate decision support tools, educational videos, and helpful links to helpful resources. And lastly, our customized education series, utilizing local experts and is tailored to meet the needs of family caregivers. The educational topics that we speak on include caring for a loved one with Alzheimer's or related dementia, understanding and paying for long-term care, and self-care for caregivers. Elder Care Coach is able to partner with your employee resource group, and EAPs and any other benefits to help drive utilization and help navigate caregiving challenges more effectively. I'm also proud to let you know that we recently started working with Sarah Cannon Research Institute to provide elder care coach as an employee caregiving employee benefit. Next, I'd like you to hear from Rosemary. Rosemary is a working caregiver who used elder care coach.
So, my name is Rosemary Brunton, and I was a caregiver for my father. And I had a unique situation where we lived about 4 hours apart in different states. He became bedridden, and there were specific challenges where he did not want to seek care in a facility, or he just wanted to be home. As a caregiver and also a full-time worker in the workforce and a mother, it became extremely stressful. I first learned about Elder Care Coach through actually my work, and I quickly learned that it would just be a landing space for me to understand if I'm on the right track, if I'm utilizing all the tools available in my tool belt. And to be honest with you, it almost acted as a mental health space for myself. Like, okay, there are no checklists for everyone in caregiving. Each individual is different. For me, I'm doing everything that I can. So my call to Elder Care Coach provided me with resources that I didn't even realize that were out there. Services to help manage his health care, eating and nutritional services, to the legal services that were provided, through a list of information that helped me navigate the woods of caregiving and being able to provide the best care I could for my father when he really needed me.
All right. So, what happens in a coaching call? I just wanted to give you a brief overview, and we talk about coaching calls both as coaching calls, navigation, consultations. It's really a time the caregiver can share their story with an expert. So the caregiver schedules a call at eldercarecoach.org, or they call AgeWell's main phone number. The call is confidential. The call allows the caregiver to share their unique situation, their concerns, to ask questions. The coach listens, provides feedback, and connects the caregiver with appropriate resources, support, and education, and ends the call by helping the caregiver come up with an action plan and next steps. Some topics that we might hear caregivers talk about on those calls could be everything from the safety of their loved one. Are they are they at the right level of care in terms of safety? Do they have the right level of care? Housing needs, help in the home, how to help their loved ones stop driving, how to have that conversation, education about dementia, legal and financial matters, caregiver stress, and really the list goes on. So I also want to mention that Elder Care Coach is both for caregivers, really for caregivers in crisis, but also caregivers approaching the role of caregiving, and honestly, for caregivers everywhere in between. Just a couple quotes that I wanted to share with you. We know from feedback that caregivers who have utilized an elder care coach phone consultation, through that, we know we're meeting the need and providing helpful care and navigation support. And you can see on the screen, these are quotes by caregivers who used elder care coach. And they said, "It was so helpful to hear from a professional that I'm caring for my mother well. Thank you for your help with sibling conflict." So we do facilitate calls that sometimes between multiple people involved in that care to help kind of work through some of that conflict. Another caller said, "Thank you for the time you took to listen to me. And lastly, it was a pleasure speaking with you. I appreciate you taking the extra time to ask about my wellness as well. You're an excellent listener." And these were with our elder care coach, Rebecca. So we know this type of service is really meeting the need. One resource I want to tell you about real quick on the Elder Care Coach website is our Rubric tool. Rubric is a company out of North Carolina that we partner with to create these modules. The module that you can see on the screen is a brief assessment that a caregiver can take. It takes about 5 minutes. It's about 20 or so questions. It's called Is It Time to Get Help? And it really allows the caregiver to answer questions based on their loved one's safety and quality of life needs. And then Rubric will populate what it calls a care fit report at the end of that assessment. And it really lets the caregiver know, based on what you said, this is probably the level of care that your loved one is needing. It's kind of gives them a starting place. We're also getting ready to add a module called Is It Dementia? And so it doesn't take the place of a caregiver taking their loved one to the doctor, but it does give them some thoughts on what is their loved one experiencing and could it be a type of dementia. Real quickly on our directory of services, because I do want to leave time for questions. This is just a book that we have, a resource guide that actually we're really proud of. We have been producing this resource book for 40 years this year. We update it every 2 years. It does come in book and it comes online as well. It includes vetted information. It's very inclusive for really any resource that an older adult or caregiver or professional might need in our community. It does cover the 13 counties that AgeWell serves. However, there are also some national resources mentioned in the directory that could really be helpful to a caregiver or older adult wherever they're at. You can see our phone number. Anyone is welcome to call that if they're looking for a resource or looking for a directory of services. However, they are available they're free at every public library in the 13 counties that we serve. It is also available on our website at agewelltn.org. These are the chapters that the directory includes. And again, really it's everything and anything that that older adult or caregiver might need along their journey. I'm not going to go over every resource just because I want to give us time for questions, but I do want to just point out that these are some of the resources that we would share with a caregiver that we work with. So it is really important that they know about all of the resources in the community that can help them. If they're caring for someone with Alzheimer's or a type of dementia, there's local resources through their area agency on aging and disability that can help them. One resource that we know is so important for caregivers is respite. You probably have heard of that term. Respite just means a time of rest. And the Tennessee Caregiver Coalition, listed on the screen, is just one resource that can financially help caregivers fund respite for themselves. So we want to make sure caregivers know about that. And so again, these are just a few of the resources that we would direct the caregiver to in that coaching call. But it kind of shows that there's just a lot to figure out, and another reason why a program like Eldercare Coach or another caregiver support program can be so helpful. So to end the presentation, please think about your questions, but I just want to remind you kind of why a program like Eldercare Coach can really be a great benefit for caregiving employees and their employers. I want to just share a very brief story. My boss, Grace, shared with me. She said that she once had a friend that's a lawyer tell her about an employee who was trying to figure out care options for her aging mother. And she said, I will pay you to help my employee figure out her best options in a 30-minute phone consultation rather than her spending hours and days trying to figure it out at work. So again, that just speaks to how helpful a caregiving employee support program can be. So whether it's Eldercare Coach or another program out there, it's going to show your employees that their health and well-being is a priority. It's going to boost their emotional health and reduce stress and feeling isolated. It's definitely going to increase their productivity at work because they're going to have someone on their side helping them find resources, support, and education. It's going to give them peace of mind that they're getting professional guidance and support. It's going to reduce costs to the employer in medical and leave claims, as well as help the utilization of other benefits. Again, it can cross-reference other benefits like EAPs or legal benefits that you may provide as an employer, and it's going to reduce employee distraction and absenteeism. So to conclude, thank you for attending this webinar. I hope you are leaving today's presentation understanding more about who caregivers are, what they are juggling, and how you can help support them in the workplace, which also helps you as the employer. We believe that this is something you can't afford not to do. Whether it's elder care coach or another benefit provider, please continue to explore the options for supporting your caregiving employee. AgeWell welcomes the opportunity to talk with you more about elder care coach and how we can help you care for your caregiving employees. We are also happy to attend benefits and health resource fairs for your employees or offer a complimentary educational presentation on caregiving. With so many services and community agencies to consider, caregivers really need and want personalized, local expert guidance to determine their best fit options. And that's where Elder Care Coach really helps. Thank you so much, and I'm happy to take questions. You can also see my information on the screen, my name with my email. We have two websites, our main AgeWell website, agewelltn.org, as well as the Elder Care Coach website, eldercarecoach.org, and our local phone number available Monday through Friday during business hours. But I'm happy to take any questions that we may have in the chat or any other questions that have come up.
Thank you, Tiffany. Really, really appreciate all of the information. Would like to thank AgeWell as well for sponsoring this. I mean, personally, right, we talked about how this is of interest to me, very timely. So this was very informative for me. I'll definitely be calling for that consultation. But we do have a question in the chat. So that is, do you only offer resources in Middle Tennessee? We have employees in 15 states and would be interested, and we can offer the benefits to all.
Yes, great question. I'm glad someone asked that. So, our directory of services obviously is a local resource guide. However, many of the resources that caregivers might need along their journey, we know where to find them. There are national websites that include elder law attorneys, that include geriatric care managers, that include the local area agencies on aging and disability. So, although we are local subject matter experts, specific to Middle Tennessee, excuse me, we know where to find the resources. And so, for example, one of our current partners that's using elder care coaches, their caregiving employee benefit, they have employees in multiple states as well. The conversations that we have on the phone with caregivers are going to be the same wherever they're located, because we know caregivers are juggling and dealing with many of the same issues. And if we are not aware of a specific resource in their community, we know where to find it. And so, yes, we can offer elder care coach wherever the employee's at. Great question.
Wonderful, thank you. I'm not seeing any other questions come in, but once again, I just want to thank you and I want to thank AgeWell for sponsoring this. Once again, super informative. If anybody has any questions, this was recorded. This will go up on mtsherm.com. And then all of Tiffany's information is right there, so don't hesitate to reach out, everybody.
Please do. Thank you, Jack. And
Thank
thank
you.
you to MT Sherm. Yeah.
Absolutely. Thank you for your time. Thank you everyone for being with us. And we'll give you a whole 2 minutes back in your day. I know it's super exciting.